understanding hernias, types, causes, and symptoms. When 5-year-old Sunita started complaining of stomach pain, her mother assumed it was just from eating too many sweets. But when the pain persisted and swelling appeared near Sunita's belly button, a trip to the doctor revealed something unexpected: an umbilical hernia. Many people believe hernias only affect older men, but they can happen to anyone at any age, even children. A hernia occurs when an organ or tissue pushes through a weak spot in the surrounding muscle. This often appears as a noticeable lump that changes in size depending on movement or position. While hernias can be painful, they don't always cause discomfort, but most will require surgery at some point. Let's take a look at the most common types of hernias. Inguinal hernia, the most common type, making up 75% of all hernias. It mostly affects men and occurs when part of the bowel pushes into the inguinal canal near the groin. Umbilical hernia happens when part of the intestine pushes through a weak spot near the belly button. Most umbilical hernias resolve on their own in children, but may need surgery if they persist. Femoral hernia is less common and affects the femoral canal located below the inguinal area. It's more common in women and can lead to complications if left untreated. Hiatal hernia occurs when the upper part of the stomach pushes through an enlarged opening in the diaphragm, leading to symptoms like heartburn or difficulty swallowing. Congenital diaphragmatic hernia, a serious birth defect, happens when the diaphragm doesn't fully close during fetal development, allowing organs to move into the chest and affect lung development. Hernias can develop due to several factors, including muscle weakness or increased pressure on muscles. Some causes include birth defects, aging, injury or surgery, heavy lifting, chronic coughing from conditions like COPD, pregnancy, and being overweight. The most common sign of a hernia is a bulge or lump in the affected area. It may disappear when lying down, but reappear when standing or coughing. You might also feel pain or discomfort around the lump. In some cases, like with a hiatal hernia, specific symptoms include heartburn, chest pain, and trouble swallowing. While hernias aren't always immediately dangerous, they can become serious if left untreated. A hernia becomes an emergency when it gets trapped, cutting off blood flow to the tissue, which can lead to necrosis or tissue death. Since hernias usually don't go away on their own, surgery is often required to prevent complications. Finding the right doctor for diagnosis and treatment is key. A specialist can assess your condition, recommend the best treatment, and prevent complications before they become serious. Remember, early diagnosis and timely treatment can make all the difference. Stay informed, stay healthy, and don't ignore the signs.